Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I'm talking from the Regents Park of Boca Rehabilitation Center, where I'm watching over my husband. So I was so glad that Dr. Burton Feinerman would come to our show this morning, and even though I love to be with him and see him, I certainly I'm glad you're there. How are you?
Hope Bill is recovering and quickly, and that everything will be.
It's not quick, but I appreciate it, and I certainly will talk to you at another point in that we can talk about. But I want to talk about you. I hear you've had some pretty exciting news.
Well, we just it really hasn't changed in the sense that we're waiting for we've had some investors state that they're going to put a great deal of money into my company, and so that we can move ahead and have a much more modern facility and open up satellite offices. Well,
Dr. Feinerman, excuse me, why don't you tell our listening audience just what you do and what you're looking to do and what your your expertise is? Well,
I have been in medical practice for 63 years now, and in the last 12 years, my focus has been strictly with stem cell and gene therapies, and it's been an interesting ride. I started off while I was still when I was practicing in Hawaii, Florida, in Maui, Hawaii, and but that distance was so great from the mainland that I moved and continued doing stem cell and gene therapies here in Florida, and it's been an evolving experience as the science improved and became more and more desirable and effective. We live in a giant world where there's just hundreds and hundreds of millions of people suffering from diseases that are labeled incurable, and I just don't like that term. I think that every disease potentially has a cure, and it's a question of time and the wonderful scientists that come up with discoveries that help us provide care for patients. I can recall back in the 1970s when Steven Rosenberg came up with the idea of that we should focus our attention on the genetic expression of tumors and cancer, and also the immunology of these cancers. And he was the head of the National Cancer Institute. He was a very prestigious person. Yet his advice was not heeded until just the last 5 years, in which there's been a sudden emphasis in all kinds of major cancer centers on just that. The same thing, although to a lesser degree, was penicillin was discovered in 1928, but patients did not receive the penicillin or the use of it until 1946.
So, Dr. Feinerman, why is that? Is it that, why are people are they just being over careful, or what causes that when you have something that can be so powerful?
Well, I really think we have to focus on why it's not more widely used in the United States, because in Europe and throughout South America and many places in Asia, such as in Japan, the Philippines, Singapore, Thailand, stem cell treatments are widely used and accepted and approved by the different governments. And so there's no question. We had years ago, as you can recall, a drug called thalidomide that was widely used. Yes. And unfortunately, that led to people being born with very severe birth defects, particularly no arms or no legs or things like that. And so I think that, that's just an example of where things moved a little too quickly. But I do think that it would be that there should be easier ways for clinical trials to occur without going through the enormous $100 million expenses that are required in order to satisfy the approvals of pharmaceutical companies and so forth.
But Dr. Feinerman, why is it that you are so strong about this and a lot of other doctors aren't? They're afraid, and I guess you have seen such good results. Is that why? Well,
that's absolutely correct. And plus, there are all kinds of medical magazines that talk about results in treating various serious conditions in other countries, and which doctors have available. I think doctors are just kind of they go to medical school, they get their fellowship and postgraduate residency program, and they're still practicing what they did 20, 30, and 40 years ago without the slightest desire to, they just won't even consider it. There's a nephrologist just right next door to me by the Wellington Hospital Medical Center, and I told him, I can make you the most famous nephrologist in the world, and he's only 38 years old, and I recommended a book to him to read called Regenerative Nephrology. I saw him in the hallway one day about 6 months later. Said to you, "Have you read the book yet?" He says, "No, I haven't read it. I've been so busy with my office and my seeing patients in the hospital and treating people on dialysis." And to me, that's baffling, just baffling. And
let me get down though, so the people understand stem cells, because you're such a master at this. When you find someone who has a problem and you believe that you can help them by giving them stem cells, why don't you talk about what that whole procedure is like and why and everything with it?
Well, I mean, the FDA has opened the door a crack, and although they have vacillated in even with the statement that if you can take stem cells, you can treat patients with mesenchymal stem cells that you can extract from the patient's own adipose abdominal fat or bone marrow, but you can't culture it, and you cannot manipulate it, and you must use it what you've extracted within 24 hours or sooner. And so that has opened up the opportunity to treat a lot of these diseases, but it's the only group that's really jumped in a big way has been the orthopedic specialty, in which they're treating patients with osteoarthritis of the various joints, particularly the knees and the hips and the shoulders. So
why do you think that's true?
Well, I don't know why it's that one group that's doing it, because there's just such a need. I myself am beginning to focus and try to market myself to the community, the country, the world, about treating patients with blindness. I mean, imagine being faced with blindness, whether you're a young person, middle-aged, or even older, and suddenly you lose your eyesight. And there are successful treatments that have been reported throughout these countries that I mentioned to treat macular degeneration, both dry and wet macular degeneration, to treat genetic diseases like retinitis pigmentosa, Stargardt's disease, which causes blindness and macular degeneration, a genetic disease in children, and they go blind by the time they're around 10 years of age. And so these are things that can be conquered today, and and then it gets down to what kind of cells, type of stem cells you use to treat a patient, and also a method of administration. For example, I had developed protocols to treat lung disease, COPD, pulmonary fibrosis, emphysema. A group of investors took over my patents in that field, and with the agreement that I would also set up 5 clinics with them, which I did over a 2.5-year span, and we treated literally thousands of patients with these conditions with a very high rate of success. And yet today, there's still, and reported it and kept data on each of these patients. Yet today, as far as I know, there's not a single pulmonologist in the United States treating patients with these conditions. So it is
very disappointing to you, because
disheartening and surprising.
Yeah, must be. Let me give everybody a way to call you. 561-557-3358. Is that good?
That's correct. That's my office
I'll
number.
do that again. Okay, that's 561-557-3358. If you want more information about this, there's also a web site. It's called stemcellgeneticmed.com. Stemcellgeneticmed.com. And Dr. Feinerman is, he's had a long career of a lot of things he's seen, but he's always on the cutting edge, and he feels so strongly about this. Doctor, after Bill gets a little bit more with physical therapy and a lot of other things, I definitely, and want you to look at him and to see what we'll be able to, any of his deficits, to see how we can help him, because, as you said, Europe is so far ahead of us, so many other places. Stem cells is just a normal way to treat people, but because we've had some, a lot of things going on here, I don't want to call it political, but that's what it is in a way. It's just prevented people from getting the very best of their life.
Yeah. Well, instead of building a wall, I want to tear the wall down.
That's good. Very good point. Right. Stop building walls and tear the wall down and let people do this. So as an MD, of course, you've experienced a lot of things. You've told some wonderful stories about some people who have come to you. And I don't use the word miracles. It's not miracles. It's just medical data and using what you know, and it's helping people. There's some spectacular stories that you have told. Maybe you ought to reiterate some of them and some of the good results.
Well, initially I focused a lot on neurodegenerative diseases, and I still do, ALS, Parkinson, Alzheimer's, multiple sclerosis, and autism. And these are formidable diseases which, when patients receive the right kind of stem cells, meaning neural brain stem cells and brain nerve growth factors, usually 4, and these are introduced by a simple spinal tap. Giving it IV, it'll never get past the blood-brain barrier. We've seen considerable, first stopping the progress of the disease, as well as seeing continued improvement and reversal of the disease process. I do think that in some of these cases, that what I've discovered over a period of time is that one treatment is not going to be successful. And that was, I was naive enough to think that that one treatment could do it for these overwhelming conditions, but there are repeated treatments that are necessary, and you have to also keep up with even the latest discoveries. Despite the fact that we've gone hundreds and hundreds of years studying the brain, it was only 6 months ago that we found that the brain had a lymphatic system just like every other organ, and it helps to get rid of waste products. And here these pharmaceutical companies have spent hundreds of millions of dollars to try to get rid of, in the brain of these patients, misfolded proteins like beta amyloid and tau protein, which when they aggregate and form clumps in the brain, make the patient go downhill rather quickly. So, you have to utilize what nature lets us know to change and add other things to the treatment.
Dr. Feinerman, do you do a lot of research? I mean, you must read a lot, don't you?
I do. I mean, that's really my methodology. I read about what someone's doing in Finland, or someone's doing in Japan, or someone has discovered something in Brazil, and I often will combine many of the good features of these discoveries into one treatment, and which allows to the benefit of the patient. I mean, a patient came into my office just 2 days ago. He had been born in Haiti, and ironically, it's a small world. Because I used to volunteer and do work for the Seventh-day Adventista church in Port-au-Prince, Haiti, and then later I did it in Cape Haitian with Dr. Millen, who had built a hospital up there with the family's money, and lo and behold, this man was amazed at all the people that we mutually knew from Haiti. Anyway, he had end-stage kidney disease. His kidneys were like 10% functioning. 10%. I don't know how. And you look at him, and he looks completely normal.
Was he in dialysis?
He should have been on dialysis probably 2 years ago. Anyway, for his own personal reasons, he decided not to have dialysis. But I said, you really probably have to get it at least initially, and until at least you just get a stem cell treatment. And the stem cell treatment is relatively simple. We isolate out stem cells from his bone marrow and fat, and then we. But if you here's a good example. If you give that the right stem cells, but you give it intravenously, it'll never get to the kidneys. Never. You have to use the work of an interventional radiologist who passes a catheter through a small blood vessel in the upper thigh of the patient, and under direct X-ray visualization, passes it up to first the right kidney and then to the left kidney. Yet, I cannot find a single interventional radiologist in the United States, even though I'm following FDA guidelines to do this. I have to go to Cancun, Mexico, and treat patients doing it that way. And that's so ridiculous. Ironically enough, just yesterday I got another patient with a very serious kidney disease, and this patient wants to come to see me from Hungary.
My God.
And so, I mean, if the patient's able to get all the way over to the United States, wouldn't it be nice if I could just, because the treatment could definitely and so simply be done here. There's an interventional radiologist right up here in Boynton Beach, and he's the only one that I know that has a private practice, and they almost all the rest of them that amount to many thousands work and are connected with hospitals, and try to get through the politics in hospitals would be really tough. So
that is really so horrible when I hear about this, that they're so afraid of something that is on the cutting edge, and yet it's been shown in Europe and other places to be correct, and then you take it out of the country, you do have successful results, and yet they don't even want to see that. Yeah,
well, I mean, I've tried many times to talk to this doctor in Boynton Beach. I'm not going to mention his name.
No,
he's a very fine professional person, but yet to me it's hard for me to understand why he would not consider doing it. Mm-hmm. I hope he's listening.
Well,
and the same thing is true with diabetes. If I can have the right type of stem cells to treat a person who's on insulin or even on an insulin pump, but yet I can't give. You can't just simply give it intravenously. It never gets to the pancreas, and again, you have to use an interventional radiologist for these patients as well.
And so it's really the stem cells you're using are from the exact person. It's their own stem cells, right?
Yeah, right. Yeah, and so it's hard to I'm sure people listening to this are confused and don't understand, and I'm in the same camp with them. I don't understand either, when new ideas come along, the first attitude with the medical profession is, "Oh, that's ridiculous, that idea," and then months or years go by, and they say, "Oh, you have to show me more evidence." And of course, how can you show more evidence if you can't do it? I
was going to ask you a question, because I know that you were a pediatrician for so many years, and when the polio shot first came out, because that was something new, were they feeling the same way? Were they not, wanting to do that because they were afraid?
I think there was precedent about vaccination. I mean, people will, for many, many years now, had been getting smallpox vaccinations. Their children have been getting vaccinations for diphtheria, tetanus, and polio, and hepatitis. So the idea of another vaccine was not, wasn't so revolutionary.
Well, I have to just tell you, I know we've run out of time. I want to give everyone your phone number again, 561-557-3358, or go to their website, stemcellgeneticmed.com. Sorry I wasn't there with you, but I was there in heart.
Right,
and I appreciate so much that you were there, Dr.
Right. I'd just like to add that the consultation is at no charge, and so the people
Everybody come.
Yeah, come on.
Meet him. He's
We're
a
waiting
wonderful
for you.
man, too. Okay, thanks, Dr. Feinerman.
Thank you.
Talk to you again.
Bye-bye.